After traveling to Mexico for a family vacation celebrating her 11th birthday, Belle Williams began to suffer from extreme abdominal cramping, vomiting, and diarrhea.
She's usually such a healthy child. I just didn't know what was going on with my baby. It was really sad to watch her in pain and not know how to help.
Belle's mom rushed her daughter to the hospital after she threw up blood one night. The ER gave her fluids by IV and sent her home with lab work that was to be completed. They met with the doctor, and the doctor determined there was no use in completing the test, as Dr. Wilcox was sure of what it was. Belle was suffering from giardia, a parasite originating in Mexico that comes from drinking contaminated water. Her case luckily wasn't believed to be life-threatening, so she was put on antibiotics and sent home.
I started feeling better, but my symptoms never really faded away. They eventually came back, and I knew my treatment wasn't working. So we went back to Dr. Clark to talk to her.
She seemed even worse than before. She couldn't hold her food down, and she was curled up in a ball crying for most of the day until she tried to sleep. It was torture.
Rushed to the ER yet again, Belle's mother, Agatha, requested a different doctor for her child. After meeting with gastroenterologist Dr. Clark, an upper endoscopy and colonoscopy was ordered, as well as blood tests and a stool test. When the results came in, Belle knew she had been misdiagnosed, and she knew her life would be permanently changed.
Crohn's disease is an autoimmune disorder in which the body attacks the tissue of the ileum region and the small intestine, causing active ulcers. For Belle, this means malnutrition, a constant burning sensation in her abdomen, and frequent vomiting or diarrhea with blood in the stool. She was so underweight. It was like I was watching her fade away with my own two eyes and I couldn't stop it. The doctors put her on steroids and a combination of 2 diets to try out the inflammation and manage her Crohn's. For the first time in a while, I had hoped that Belle would be okay.
Belle Williams is being put on an SCD diet, a FODMAP diet, and a prednisone steroids.
I started to feel better, but my symptoms never fully faded away. Eventually they were returning, and I knew my treatment didn't work.
Methotrexate made me feel better until it didn't. One day I threw up out of the blue and the rest of my symptoms came back, all too familiar to me. I brushed it off as something I had eaten, but after my symptoms came back, I noticed I was also losing interest in everything. I felt sad. My mom took me to a psychologist, but things just kept getting worse.
It was like she had just given up. So, with Belle's permission, we went back to the doctor to see what could be done. A side effect of methotrexate is depression, which Belle seemed to be suffering from. Added on to the fact that her symptoms had returned and that she had gained an immunity to the medicine, it was decided that she needed to be put on a new medicine, Humira.
Humira is a tier 3 medicine, meaning it's the strongest medicine used to treat Crohn's. It had the potential to be a dangerous medicine for Belle, but she was running out of options, with her symptoms worsening and all.
Belle seemed to be doing great on Humira, but after a while, I noticed she started to lose weight again. She complained about stomach cramping, constipation issues, and constant fatigue. I assumed that it was another relapse of Crohn's, but what waited around the corner was the unimaginable.
When Dr. Clark got the results back, he had an urgent tone in his voice. He told me I had colon cancer as a result of Humira. My mom grew hysterical. She didn't know how this could happen, and us not know about it. Getting cancer from Humira is extremely rare. I guess I had just been unlucky. Dr. Clark referred me to an oncologist, Dr. Matthews, who specialized in pediatric cancer treatment. I was scheduled for a colectomy.
The patient is now asleep. I will now be performing a colectomy. This is removing the damaged part of the colon.
Get the CT scan out of her.
McKenna, that was terrible.
Oh my god.
Beep. Beep. Beep.
Your daughter is deceased.
Belle Williams died from surgical complications during a colectomy involving an accidental puncture wound and post-surgical pneumonia. She died at age 16 and will be dearly missed.